Have you ever wondered what signs your body might give before a critical health event like a stroke? Well, you're not alone. Strokes are serious medical emergencies that require immediate attention, and knowing the warning signs can make all the difference. A stroke, in simple terms, is a sudden disruption of blood flow to the brain. This can occur due to a clot blocking a blood vessel, or when a blood vessel bursts, causing bleeding in or around the brain. Regardless of the cause, the result is the same. The brain is starved of oxygen and nutrients, leading to the death of brain cells, which can cause lasting damage or even be fatal. That's why it's so important to understand the early warning signs of a stroke. The sooner a stroke is detected and treated, the better the chances of reducing the impact and improving recovery. But what are these signs? And how can we recognize them in ourselves or in others? It's not always easy. Strokes can vary greatly in their symptoms depending on the area of the brain affected and the extent of the damage. However, there are some common signs that might appear a month before a stroke occurs. These signs can be subtle and easily dismissed, but they should never be ignored. Sudden numbness or weakness, especially on one side of the body, trouble speaking or understanding speech, vision problems, dizziness, loss of balance, severe headaches, facial drooping, difficulty swallowing, fatigue and nausea or vomiting can all be potential warning signs of an impending stroke. Understanding these signs and taking them seriously is crucial. If you or someone else exhibits any of these symptoms, it's important to seek medical help immediately. Remember, time is of the essence when it comes to strokes. The faster you act, the better the chance of survival and recovery. With this understanding, let's delve into the warning signs of a stroke that might appear a month before. Each sign is a piece of a larger puzzle, and by recognizing them, we can take proactive steps to safeguard our health and potentially save lives. The first warning sign that might hint at a possible stroke is sudden numbness or weakness. This isn't a subtle sign. Instead, it's a clear and abrupt change that can occur without warning. You might find that your face, arm, or leg suddenly feels numb, or that you're struggling to hold objects or keep your balance. This symptom typically affects one side of the body, so if you notice a sudden change in sensation or strength in your left or right side, it's time to take note. The second sign we're going to discuss is trouble speaking or understanding. This might manifest as slurred speech or difficulty forming words. You might find yourself struggling to articulate your thoughts or find the right words. Similarly, understanding what others are saying might become a challenge. This can be incredibly disorientating and frightening, but it's crucial to recognize it for what it is, a potential warning sign of a stroke. Our third warning sign is vision problems. This could involve blurred vision, double vision, or even loss of vision in one or both eyes. This isn't about needing a new prescription for your glasses. It's a sudden and unexplained change in your vision that can't be explained by other factors, such as fatigue or eye strain. If your world suddenly becomes fuzzy, or if you lose sight in one eye or both, it's essential to seek medical attention immediately. These are just the first three signs. Our bodies are complex, and they often give us clues when something isn't quite right. These initial signs, sudden numbness or weakness, trouble speaking or understanding, and vision problems, are critical indicators that something might be amiss. If you or someone you know experiences any of these signs, it's crucial to seek medical attention immediately. Remember, when it comes to a stroke, time is of the essence. Let's continue with the rest. The fourth warning sign of a stroke is dizziness or loss of balance. Picture yourself walking along a straight line when suddenly you feel like you're on a roller coaster ride. You might feel lightheaded, dizzy, or even experience a loss of balance or coordination. This can often make it difficult to walk, stand, or even to maintain your stability. If you or someone around you is experiencing such symptoms, it's essential not to brush them aside as mere fatigue or weakness. These could be clear indicators of a looming stroke. Moving on to the fifth warning sign, which is a severe headache. Now, we all have had our fair share of headaches, but a headache that could be a warning sign of a stroke is unlike the usual ones. It's sudden, severe, and might feel like the worst headache you've ever had. This is more common in hemorrhagic strokes, which occur when a blood vessel in your brain bursts, causing blood to seep into the brain tissue. If you experience a headache that's unusually intense, especially when accompanied by other symptoms we've discussed, it's time to seek immediate medical attention. Now let's talk about the sixth warning sign, facial drooping. If you notice one side of your face or someone else's face drooping or feeling numb, it could be a sign of a stroke. A simple way to check for this is to smile and see if one side of the face reacts differently than the other. If there's an uneven smile or a part of the face doesn't move, it's crucial to seek help right away. These warning signs might appear individually or in combination. The key is to be vigilant and proactive. Remember, every second counts when dealing with a potential stroke. Early detection and immediate action can significantly improve the outcome and recovery chances. Let's move on to the final 3 warning signs. Difficulty swallowing might not seem alarming, but it's actually the 7th warning sign of a stroke. This symptom can sneak up on you, appearing as a sudden onset of difficulty in coordinating the muscles needed for swallowing. It might feel as if your throat is tightening, or you may find yourself choking on your food or drink. Don't brush it off as indigestion or a simple case of food going down the wrong pipe. Next, we have fatigue or weakness. This isn't just a case of feeling a bit tired after a long day or a poor night's sleep. We're talking about a sudden, unexplained fatigue or weakness that may be localized to one side of your body. It might seem like you've suddenly run a marathon without actually moving. This exhaustion can make it hard to lift objects, walk, or even stand. Lastly, we have nausea or vomiting. It's easy to attribute these symptoms to something you ate or a passing stomach bug. But when these symptoms are accompanied by other signs of a stroke, they should not be ignored. It's particularly noteworthy if the nausea or vomiting is severe or comes on suddenly, especially if it's accompanied by any of the other warning signs we've discussed. These last 3 signs, difficulty swallowing, sudden fatigue or weakness, and nausea or vomiting, round out our list of 9 warning signs of a stroke that might appear a month before. It's important to remember that not everyone will experience all these signs, and they can vary in intensity. Just as a quick recap, the 9 warning signs of a stroke are sudden numbness or weakness, trouble speaking or confusion, vision problems, dizziness or loss of balance, severe headache, facial drooping, difficulty swallowing, fatigue or weakness, and nausea or vomiting. Remember, recognizing these signs early can make a significant difference. If you or someone you know exhibits any of these symptoms, don't hesitate to seek medical help immediately. Time is of the essence when it comes to strokes. The sooner treatment begins, the better the chances of reducing the damage to the brain and achieving a full recovery. It's crucial to remember that early detection can significantly improve the outcome of a stroke. As we've just explored, recognizing these warning signs is paramount in ensuring the best possible recovery. Strokes are sudden and often devastating, but understanding these signs can give you an edge, a chance to act swiftly and possibly save a life. Each of the 9 signs we've discussed today, from sudden numbness and weakness, trouble speaking or confusion, vision problems, dizziness or loss of balance, severe headaches, facial drooping, difficulty swallowing, fatigue or weakness, to nausea or vomiting, are critical indicators. They can be sudden, subtle, or gradual, but they all point to a possible underlying issue, and that is a stroke. Remember that these symptoms can occur individually or in combination, and they often appear without warning. So if you or someone you know is experiencing any of these signs, please don't hesitate. Seek immediate medical attention. Time, as we've mentioned, is of the essence when it comes to a stroke. Every second counts, and the sooner medical intervention is sought, the better the chances of recovery. Moreover, it's important to share this knowledge with the people around you. Awareness is the first step towards prevention. The more people who know about these warning signs, the more likely we are to prevent strokes and reduce the damage they cause. In conclusion, strokes are serious, life-altering events that can happen to anyone at any time. But with knowledge and vigilance, we can ensure we're prepared for the signs and ready to act. Share this video with your friends and family. You never know whose life you might save. Stay informed, stay healthy, and remember, we're all in this together. Thank you for joining us today. If this information has been valuable to you, Please give us a thumbs up and subscribe for more health-related content. Your support helps us keep producing these informative videos. Until next time, take care, and we'll see you in the next video.